airspaces, we shut down almost everything so because of this infection. So we were in the midst of a new pandemic, and I can say we do not want to ever go back to that place again where we see a pandemic coming. We are shutting schools, we are shutting economies, we are shutting travel. And if you remember, for us, you could not even attend a wedding. We were attending weddings via Zoom. The worst part was even funerals. I don't know how it was in Rwanda, but in Kenya, funerals, you could not attend more than 10 people, and that was really distressful. So we as scientists, we are trying to make sure that the world will never go back to such a place again. We are trying to make sure that if another pandemic comes, and trust me, another pandemic is coming, it's going to be coming, and we have to be ready as a society, as a community, as a continent to make sure that if another pandemic comes, we are ready, we can diagnose it quickly, we can treat it quickly, we have ready vaccines so that our children can go to school, we can go to work, and we can have thriving communities. So that's how I'm asking, where do we go from here? What are we doing about it? What are you doing about it in your societies, in your schools? Have you continued to talk about COVID-19? Are you continuing that public health message? Because again, we want to equip you to be champions, not just for COVID-19, but for other diseases that face the African continent. Are you teaching the children or the young adults that you're teaching to continue to wash their hands and to observe good hygiene? Are they wearing masks, particularly if they're feeling unwell or if they have a respiratory infection? Those are lessons we learned from COVID. And in Kenya, I was giving an example where we sit, or where I sit. My office is next to the largest referral hospital in East and Central Africa. It's called the Kenyatta National Hospital. And for the first time last year, we saw diarrheal diseases going down. We saw less children having diarrhea diseases and also stomach infections. Why was that? Because people were washing hands. People were very careful of what they ate or what they consumed. There was social distancing, and this was lessons we learned from COVID. So we need to continue doing that. We need to continue to observe good hygiene so that we stop hearing about cholera. Cholera keeps coming back again and again. We need to stop hearing about other diarrheal diseases such as typhoid and dysentery. And how do we do that? By observing the simple rules that were introduced or we spoke about during COVID-19. So really, my question is, where do we go from here? The next slide. And for once, I do not want us to go here. The slide in front of you, there's been many headlines of infections coming in and out. The last few months, the East African region, we have been on high alert because of Ebola, which is at the bottom here. There's always an outbreak that we hear about, either in Uganda or on the Congo forest or near the borders of Kenya. So the entire continent is on high alert, which is very good because, again, we want to make sure we can detect any of these infections and treat very quickly to avoid the deaths, to avoid lockdowns, and to make our societies better. So we are here today to avoid these headlines from ever coming again. We have been talking about killer viruses. Remember Zika in Brazil and South America, children were being born with a bit of deformities, again, because of the Zika virus. So what are we doing about it? So we need to continue this drive of public health conversations, making sure that our scientists, our Ministry of Health, our government, we are all working together to make sure we can detect any disease that will come so that we can, I keep saying, have a thriving community. So are we preparing for the future in the COVID-19 era? And this, again, that's why we're here. We are public health champions. As we said in the beginning, teachers, you have the biggest voice. For me, I get, as I mentioned, a lot of satisfaction knowing I'm impacting knowledge to the next generation of leaders, next generation of doctors, of people who make a change in our societies. So I'm hoping that by the end of this, you'll be inspired to continue inspiring and mentoring and nurturing the students that you encounter. But before that, just to make sure that we are all on the same page, I've been talking about diseases. I've spoken about Ebola, typhoid, and many others. But the disease that has brought us together is COVID-19. And just as a recap, because now we need just to, it's always good to recall where we came from so that we know what we're going to face in the end. And if you can remember, it's caused by a virus, SARS-CoV-2. And again, this was more or less of a new virus, but as virologists, we know that it belongs to a family of coronaviruses. They've been there for many years. We had studied this virus. So when it came, the new mutation of SARS-CoV-2, we knew exactly how it spread through droplet infection. So the virus would travel either on your cough, on your spit, or when you're very close to each other. So that's why we quickly advocated to people to wear masks, to social distance, and to wash their hands thoroughly, because the virus would stick on these surfaces. And I'm so proud of our African continent because we really adhered to these rules. We really adhered to the public health conversations. And again, the outside world, the Western world, the European world has been studying the African continent, just trying to wonder, how did we survive the pandemic? If you remember, Bill Gates came on TV and he was very concerned when COVID-19 first came. And his biggest concern was saying, oh my goodness, what about Africa? Once COVID-19 reaches Africa, it's going to wipe the Africans out. But again, God being on our side, the public health message that again was being driven over and over again by our governments, Africa CDC, organizations such as the MasterCard Foundation, and many others who were able to control these infections, and a message got to everybody who needed to hear. But again, there's a lot of unknowns. How, again, the cases in Africa were a bit down compared to the world. I have many students trying to study that, trying to study the immune system of people from the African country. Maybe we eat much healthier. And for me, as a microbiologist, I've always thought, because we've always seen so many other infections, by the time you're 10 or 20, you've reached your adulthood, your immune system has seen so many infections. So when COVID-19 came, your immune system somehow knew how to protect you from getting a severe disease. So that's a whole debate. But again, it just shows the power of communication and public health message of washing hands, wearing of masks, and avoiding spreading of this infection, which again was easily spread. If you remember the symptoms, again, it's very good to know this because it helps you identify the disease very quickly. For me, at that point, any sore throat in the year 2020 or 2021, I would quickly test myself. I was in the lab because I was very afraid of bringing that infection to my home, to my children, and I was very exposed because of where I sit and where I work. And I don't know about your experiences out there, how you protected yourself. Being teachers, you're at the front line because you're interacting with young kids, you're interacting with parents and other members of the community. But again, if you adhere to the public health message, I'm sure some of the symptoms, even though you encountered them, you are able to quickly overcome through the measures that were put in place. But then who is at risk of getting COVID-19? Because again, ladies and gentlemen, the virus has not gone away. The virus is still here, and the virus can come back and cause severe infections. So we need to also know who is at risk, and people who are in the front line, such as doctors, nurses, people in the laboratory, teachers as well. Anyone who interacts with the public very closely is at risk. So you always need to be on high alert, washing hands, wearing masks, and having that social distance is key. And again, any other people who are in a crowded situation. So I'm sure in your classrooms, by the time you reopened again, you had implemented many measures here in Kenya. They had put sinks and taps where students could wash their hands together with their teachers. Ventilations was also improved. For us in the university, we really campaigned to have bigger windows so that we could open them and have fresh air. Remember, I've mentioned COVID-19 travels through droplets and through it's airborne. So That's why we're encouraging to make sure that where you are, there's good ventilation, and not just, you're not protecting yourself against just COVID-19. Tuberculosis spreads the same way. Some pneumonias also spread the same way. Common cold also spreads the same way. So if we can protect ourselves and continue adhering to these public health measures, we will also see these other infections, particularly caused by airborne droplets, go down. Remember, I already mentioned that even we saw diarrhea infections going down because of the practices we have adopted so far. So for schools, what are you doing in terms of making sure that your learners are safe and your learners are healthy? I'm sure you have probably nurses in your school. When a student is not feeling well, they can go to the sanatorium or to the clinic and have something checked up. Are you maintaining healthy diets within the school? And also, are you dialoguing with your students? Do you talk not just about the mathematics or the science, but generally, how are they doing and how is their mental health? In Kenya, when the schools closed down for the last 2 years because of COVID, we noticed that the news reports that there was a high rise of teenage pregnancy. And I myself was pretty devastated to know that, meaning that our students, our youth were engaging in unhealthy sexual practice. So meaning we really need to keep mentoring our students. And for me in particular, I was pretty worried. If you see high rise of teenage pregnancies, you know that in the background, there'll be also high rise of sexually transmitted infections. And we're seeing that in Kenya, where we've seen a high number of youth of ages 15 to 25 having new HIV infections, which is pretty sad. We've also seen gonorrhea having a comeback, syphilis as well having a comeback. And the other day in Kenya, they reported what we're calling super gonorrhea. What does that mean? Gonorrhea that is not responding to your common antibiotics. And that is a conversation we need to keep talking to our youths about. And it's not just a Kenyan situation, it's global. I was speaking to one of our collaborators that we partner with from Canada. He's an elderly doctor in his 60s. And he was telling us for the first time in his career, he's treating syphilis. He's never seen syphilis before. He only knew about syphilis from what he was taught in medical school. And as a doctor in all that time he's practiced, for the first time post-COVID, he's treating syphilis. So again, as much as we focused on COVID, we need to have basic conversations, particularly with our youth in matters of health, keeping safe and also keeping healthy. So again, you will be charged as public health champions. And we hope that you continue having these conversations with your youth and the students. But again, the simple measures of having a healthy room, a healthy classroom, I'm sure you've adopted all this from WHO and other organizations. And I just thought I should put it here for you just to see and make sure that your schools are doing this. And during our discussions, we can look at the checklists a bit more and see areas of how we can improve our schools. So what is in our COVID-19 toolbox in terms of preventions? What we have, again, is that conversation we're having right now, public health campaigns. We have vaccines, and vaccines have the greatest weapons against infections. Again, are we testing enough? Are we noticing the symptoms? Have we forgotten about the symptoms? I hope not. And having all this in unison will be able to overcome. If COVID-19 mutates again, the virus mutates again, we'll be ready to counteract it. And how do we counteract any new COVID-19? Remember, I mentioned COVID virus has not gone away. It's still with us, but because we've been vaccinated, and I hope you have received a COVID-19 vaccine, in case it comes back again, your body is ready to fight it. And how does a body get ready? It gets ready through vaccination. In simple terms, a vaccine, how vaccines are made, they put a bit of the virus, so the protein. As a virologist, we know where to get the proteins from the virus itself. It's formulated within this vaccine and then injected into you. And what that does, then your immune system notices, oh, there's an infection. And the immune system, the way it's designed by God, is that it then produces white blood cells. And these white blood cells normally come with a memory. They'll remember that, oh, this is this infection, and this is how we fight it. So when you finally now get the real infection or encounter the virus, the immune system will remember, oh, I have seen you before through the vaccine, and this is how I will fight you. And with that, your body will not be severely affected. You may not even need to go to hospital, and if you go to hospital, you will not either be put in ICU, intubated, and fighting for your life, because your immune system has already given you that chance to fight off the virus. So vaccination is key. If you have not been vaccinated, please visit your nearest health facility and get this COVID-19, because your immune system needs that chance to be able to be trained how to fight an infection. And you may be asking me, okay, which vaccine then should I go for? Any of the COVID-19 vaccine that is available in your health facility is good enough, from the Sputnik that I think came from the Russians to the Pfizer mRNA vaccine, to the AstraZeneca vaccine. Any of this vaccine is good enough, because vaccines do one thing, and that is train your immune system to fight off the infection. So I know also there are fears of why some people have not had vaccines, and this is what we call COVID-19 or vaccine hesitancy. And as teachers and as educators and people that talk to the public, it's very important to listen to what are the concerns. Some people don't go for vaccines for many reasons. In Kenya, there are many reasons that people don't go for vaccines, not just COVID-19, even the other vaccine that I'm a real champion of, that is the HPV vaccine, that is human papilloma vaccine, that was introduced to be given to young girls and women. There are so many rumors that accompany vaccines, such as vaccines will cause our women or young girls to be infertile. They're trying to control our population, and that is not true. And we need to have a space where we counteract such hesitancies by listening and educating our populations the importance of vaccines. For example, HPV the HPV vaccine is known to reduce the rates of cervical cancers. Cervical cancer is one of the biggest killers of women in the world, the biggest cancer killer, the first one being breast cancer, then cervical cancer. But now we have a weapon against cervical cancer, and that is through HPV vaccine. And I saw data from Rwanda, your country, which is fantastic, that the rates of cervical cancer has started going down, and also the uptake of HPV vaccine amongst the youth in Rwanda is actually very encouraging, very high. And I'd like to know, how have you done it? Because in Kenya, we are struggling to have HPV vaccine given to our youth and our young girls. And I saw the report another day that our Ministry of Health was actually throwing away these vaccines because they're expiring in the storehouses. So we need to learn from you what measures you have taken. Japan also, I saw in Japan, in UK, where the rates of cervical cancer have started going down. So again, what I'm trying to allude to, vaccine hesitancy will be there with us, but we have a voice to advocate for vaccines, because vaccines have been known to save lives. So again, how do we do that? By listening, by asking, and also by educating the youth and also our population's importance of vaccines. And how do we increase the uptake of vaccines? Having this forum, for example, and you can see me here as well. We had a huge forum in our country where we're educating the population, the science of vaccines, how vaccines work. And of course, it needs partnerships. You need to have your leaders, politicians, the church, and other religious outfits being working in unison to make sure that our people are well protected. And we saw that with the COVID-19 campaign. And you can see at the bottom here, the Kenyan Ministry of Health partnered with the Red Cross and many others to make sure everybody had the knowledge of what vaccines are. But what's next? I remember I mentioned that this is not the only pandemic we're going to encounter. Many more are coming, and there are many reasons why pandemics will be coming. First of all, we are living in the era of climate change. Climate is changing. Today, actually, I saw in the news in the US, for the first time, they're having a malaria outbreak. That is never heard of before. And malaria is spread by mosquitoes. How have mosquitoes got into the areas of Texas and other states in the US? And again, it's through climate change. The climate probably in that area has become very favorable for mosquitoes. And again, that can lead to an outbreak, which can lead to a pandemic. So what are we doing about it? Already, we are living inside a silent pandemic. I don't know whether you've heard of antimicrobial resistance. WHO has issued an alert that by the year 2050, and I believe all of us will be there and alive and thriving, that by the year 2050, we'll not have any single antibiotic working because the bacteria and other germs will have mutated in such a rate that they don't respond to the medication anymore. That is very dangerous because we need antibiotics to work. Without antibiotics, you can't have surgery. We can't prevent infections. A simple cough, a simple cut can prove to be fatal. And we are living in that era now of antimicrobial resistance, and that WHO is calling a silent pandemic. So we really need to be on top of our science, on top of ways to prevent. And for me, I'm a champion of prevention is better than cure. How do we prevent diseases? Apart from all these measures he's talking about, for me, the biggest weapon we have is vaccinations, because vaccines train your immune system to fight off diseases. So what's next? Apart from vaccines, we need to all work together as a multifaceted approach to see the lessons you've learned from COVID-19. We need to be able to survey not just the humans to see what new infections are coming up, but also make sure that our animals are healthy, because most of the diseases normally jump from animals to humans. And once there's that species crossover, the disease that the humans get is usually quite fatal. So again, we need to have experts who are looking at the animal health and also our environmental health, how we dispose in our garbage, our sewage, how we interacting with the environment. Are we like in Kenya, there's a huge case of cutting down trees. What's the effect of cutting down trees? Again, it accelerates all these items you're calling climate change. And where I sit, we have a team that you're calling the virus hunters. This is a team that is composed of several people. And also in this team, they survey the country, they survey the region, and not just Kenyans, but this is a whole community of scientists within the African region that are making sure that the next pandemic will not catch us by surprise. We'll know where it's coming from, how to treat it, and how to prevent it. So we have such a wonderful team. This is one of my students, actually. It's called Dr. Joseph. He is a veterinarian. He captures animals, and in particular is very interested in bats. Bats have been known to carry viruses. Bats carry the Ebola virus, if you didn't know. So what he does, he captures bats in different caves within the country. He swabs them, the nostrils, and then he sends the sample to the lab, because we want to see what infections are the bats in Kenya carrying. And these studies are done across Africa. Even in Rwanda, we have people who are constantly doing a surveillance to make sure we know what these animals are carrying. Again, as I mentioned, we do not want to be caught by surprise. This is another set of my students, and an exchange student who, again, they were trapping mosquitoes within the city and urban areas. I'm sure this is a common sight in garages where they dispose of tires. Tires are a perfect environment for mosquitoes because they're warm, and once it rains, the water gets trapped. So again, even as we are surveilling the environment, we are educating our people how to live healthy lives, how to dispose such garbage, how to live clean, how to wash their hands, and how to eat healthy foods. And I hope you as a champions, you'll continue this public health message. So what's in our toolbox? We are going to talk about it more. We need to prevent infections. We need to do surveillance. We need to be able to test, treat, and continue to nurture a thriving community and a society. So I'll stop there. I encourage you to, if you've not had your COVID vaccine, get the vaccine and many other vaccines that will come up. Always encourage your population, your people, to go for vaccinations. Vaccines are safe and vaccines have been known to save lives. So with that, I'll stop there. As I mentioned, I'm a passionate researcher. I'm a teacher, so I can talk on and on and on. And I'm hoping to get many other forums to keep these discussions with you. So with that, back to you, Jeanette, and thank you for the attention. Thank you.
Thank you so much. Thank you so much, Marianne, for your good presentation. It's really interesting. If we could have enough time, we can even give you more than 2 hours. Unfortunately, the time is too jealous. So allow me to go through the next session, but we are also coming back to you for some other topics and questions, and hope some participants noted down some questions related to this, as I even recorded some from the chats. So be ready to answer questions related to that presentation, as it is the nicest ones. As you know, as we have been said before, we are together with different panelists. We have Christian, we have Janet, we have Marianne. Let me call up to Christian to be maybe to share with us some key points on what are the common misconceptions or myths surrounding COVID-19, Ebola, influenza, yellow fever, and malaria, and how can we effectively address or remove these myths to promote accurate information among the public. Christian and the other panelist member, you are here to share ideas on these topics, and please make sure you use not more than 3 minutes to keep time. Christian?
Okay, can you hear me, Jess?
Yes, I can.
Okay, and I hope everybody on the call can also hear me. I would start by requesting you to allow me to go off camera because I don't have good internet, and that would allow me to have at least a better voice.
Good.
Yeah, so the question addressed to me is a good one. I think it's the starting point. What are some misconceptions or myths around different diseases? I'm not going to talk like our doctor talked. That was very academic. That was very high level. I will talk as a teacher, and I will just say use the common the common language and the common knowledge around that. So if we start with defining what a myth is, I will simply say it's a preconceived idea that has been found in a society without basing on any scientific facts. So we have myths around COVID. When COVID hit, some of you might remember it was in China, and it went in Europe, especially in Italy. And then the myth was, yeah, this disease is not a serious disease. It cannot affect Africans because we have a strong genetic makeup, or because we are Black. So that was a common myth. But there were also some other myths like it's a satanic punishment, it's for the women and children and the weak men. But we all know that was not true. So for Ebola, I believe we have not had cases of Ebola in Rwanda. I stand to be corrected. But I did my research and found that in our near in Congo, people believe that traditional healers can cure Ebola, or herbal medicine can cure Ebola, or it is a curse from God. For the flu, which is technically called influenza. So the myth is that if you drink hot water or if you wear warm clothes, yeah, you'll be better. But we know that influenza is a viral infection, so it needs also to be treated, and it can also be vaccinated as a preventive measure. So yellow fever, we don't have a lot of it here. But for malaria, the myth in Rwanda is that if you drink urwagwa rushyushye, you're likely to get better. So urwagwa rushyushye, for the people on the call who don't understand here in Rwanda, it's warm sorghum beer. But these myths are very bad for the society for three reasons. So they can prevent people from seeking appropriate medical care, because these are beliefs uprooted in their subconscious. They can prevent people from following preventive measures from recognized health bodies like WHO or our RBC. They can also prevent people from accepting vaccination, the vaccination hesitancy, as the doctor talked about it. So to address this, we can do this on three levels. One, we can play with pathos, emotions. So the leaders have to respect, first of all, understand the local beliefs and values. They have to know what are the people thinking and why do they think like that. And when they're talking to the people, it's important to use sensitive language, the cultural appropriate language that addresses those beliefs. And then involvement on the ethos level. If we involve local leaders, elders, celebrities, role models, yeah, we can get rid of these attitudes and behaviors and the myths. And if we also provide clear examples and testimonies, it's also possible that people can forget about the myths and embrace science. And this could be done through different channels, could be radio, social media, it could be comics. Like here in Rwanda, we know we like comics. We like radio talk shows. We like radio theaters. We like drama. So if you use different multiple channels to reach different layers of the society, yeah, we can get rid of the myths. So Saj, I hope that answers the question.
Yeah, thank you so much. As you have been mentioned some of the common misconceptions, I think all of us, we can also list some, but the one that I kept in mind is that during even COVID-19, so people used to say that this disease is not for African, as you are saying, and this for white one, Christian. Thank you so much for highlighting some of them. But without going far, I would like you again to be quick on the second question. But you let us know about the primary mode of spread for COVID-19, Ebola, influenza. How do you think these diseases are spread? So, and how as educators can play a crucial role in, of course, educating their communities about this mode of transmission. How do you do it from your institution and around your community?
So thank you, Sajes. Again, a disclaimer, I'm speaking as a teacher. I'm not a specialist in this field. So COVID-19, it spread through the air, and to avoid it, so we wear the mask, we keep the distance of at least 1 meter, we wash our hands frequently, and we avoid touching our eyes, all the measures that and all of us on the call know. But most importantly, to avoid it, we need to get vaccinated against COVID. As the doctor said, who knows what's coming next. God forbid. But yeah, we need also to get vaccinated to stop the spread of COVID. So for Ebola, Ebola is spread through contact of blood, of bodily fluids. That could be urine, sweat, or breast milk, any other fluid that the body can produce. If you have contact with somebody who's infected, you could also get Ebola. So to avoid it, so we need to avoid contact with bodily fluids from people who are infected or from the animals. To practice safe burial, somebody died, we need to have some cautions and practice safe burial. And we also avoid contact with wild animals and bush meat. I don't think in Rwanda we are very much used to bush meat. So for the influenza, this is actually when I was reading some research, this is the disease that we take for granted. And the flu, that is influenza, we sometimes take it for the cold, the normal cold, but it's not. So the flu is spread also via respiratory systems like COVID, and it is a viral infection. It is caused by a virus. So to prevent it, there are vaccines. So that we should be taking every year. When the weather changes and there's likelihood that the flu the viruses might be around. So for the yellow fever, I know normally we learn about the yellow fever when you're about to travel, and you're coming from our countries, you're requested to have a vaccine of yellow fever. And it is important to also get vaccinated. The research says 10 minutes before you travel to an area where yellow fever is common. And in Kigali, you can get the vaccine at RBC headquarters in Gikondo. I think that's one place that I know. There might be more places. So for malaria, malaria is spread like yellow fever, mosquitoes. And the best way to prevent malaria is to use insect repellent or bed nets, cut the bushes around, or clothing that covers the whole skin. So how do we prevent it and communicate the measures to our students, to the colleagues, to the wider community? At school, in an academic environment, there could be interactive sessions like quizzes, trivia, quizzes, games, debates, role plays, just to engage the audience and to help the students to know and to learn about the diseases through an indirect approach, and to be able to internalize how they can avoid the diseases in a fun way. I believe if it starts with the school, with students, it will be beneficial for the community at large in an indirect way. We can also invite health professionals in our schools to give talks or to demonstrate some scientific experiments, and also to be active in the community. And whenever we are called upon as public health champions, we volunteer to help in Immune Vide. So that's all I had for these questions, and I hope this answers your question, Saj.
Oh, thank you so much, Christian. Meanwhile, would you also wish to hear from Jeanette to have some key points as addition to what Christian was saying about the primary mode of spread for COVID and some other diseases like Ebola, influenza, the yellow fever, and the malaria. Jeanette, could you add something before we go to the next question?
Yeah, thank you, Marie Sagesse, for your questions. To add on what Christia has said, actually, as she has said, Ebola is spread through direct contact with blood or bodily fluid. And what maybe has not mentioned is that only the disease is spread when the person is showing symptoms. Most people, they have like a misconception or myth saying that when you are coming in contact with a person having Ebola, even though he's not showing the symptoms, you will also go to suffer from the disease. But the disease only spread when a person is showing symptoms. Coming to COVID-19, COVID-19 is also spread primarily through the respiratory droplet and contact route. It means droplet transmission actually occurs when a person is in a close contact, mainly around 1 meter distance with someone who has respiratory symptoms like coughing or sneezing. Therefore, at risk of having those kind of symptoms like coughing and sneezing, and when he's exposed potentially to infective respiratory, it's where the person may be exposed to respiratory droplets. So, coming to malaria, malaria actually also people have some kind of misconception that malaria is caused by mosquito, but the mosquito mainly is a vector, it is not the causal agent of malaria. Of course, when the mosquito bites you while having malaria, it can take the malaria to another person. But actually, malaria is not caused by mosquito, but the mosquito helps in transmission of malaria from one person to another person. The same applies to the yellow fever also, which is also spread by mosquitoes. And when the mosquito also bites a person having the yellow fever, you also and it also bite another person, he may also suffer from the yellow fever. So these are kind of mode of transmission of those diseases. I hope to have answered your question, Marisa. Thank you.
Thank you so much, all of you, for your good answers for our questions. And as we are still discussing, let me again invite Dr. Marianne for the intervention. Marianne, you have been talking about vaccine, and but someone may ask him or herself, what are the available vaccine for COVID-19? And even what are vaccines that are available for other diseases like Ebola, influenza, and the yellow fever and the malaria. So if they are, what are the benefit of those vaccine in terms of preventing the spread of these diseases, as it is taking is bringing a gap, a big gap in the community, even in Africa, Europe, and the other developing country. Can you help us to know about those vaccines, its type, and how they are effective or in preventing the spread of those diseases? Dr. Marianne, you are welcome.
Thank you. That's a good question. And I think I touched a little bit, first of all, on how vaccines work. I always think vaccines work like, you're trying to prepare for that big marathon, but you cannot just wake up and run the marathon. You won't make it. You need to keep practicing. You need to keep preparing. You need maybe even an instructor to teach you on how to run. The vaccine itself is like that instructor or that practice you do before that major event or major exam. And how does it do that? The vaccine, as I mentioned, the way the vaccines are made, they use a little bit bit of that disease you're vaccinated against. So they use, if for the COVID-19, the spike protein coronaviruses. Corona means a crown, and a crown in the coronaviruses have proteins that stick out from its body. And so the scientists picked some of that protein, put it in a vaccine solution. Again, the way they make vaccines is, the science is amazing. And once following clinical trials, they validated that the vaccines are safe, then they are injected into your body. So a little bit of that coronavirus spike in your body. And what does that do? It then teaches the immune system. The immune system, the white blood cells, are going to see that spike, and the white blood cells will be like, oh, we are somehow under attack, but we can manage this. So what the white blood cells do, they produce many more white blood cells, but as they are doing so, they also develop a memory. They remember. So as they're getting rid of that infection from the vaccine, they have also stored a memory that remembers how that virus looks like and how to fight it off. So when now this vaccinated person gets the actual virus, encounters it through a droplet of someone else who's infected, the immune system will detect it very fast, because that's how God is amazing how he created our bodies. The immune system will detect it. The immune system will be like, oh, I remember you and I know how to fight you, and gets rid of that infection. So that person will, yes, maybe get a sore throat, probably feel a little bit tired, but will not need to go to the hospital, will not need to be intubated, put on a ventilator, and fight for their lives. So that's how vaccines work. And as I was saying, for COVID-19, we have an array of vaccines, from the Pfizer, AstraZeneca, Sputnik, the Russian one, there's the Novavax, there's one right now we are working on in the laboratory. And what we're doing is this: we want to make sure we can spray it in the nose. Remember, it's droplet, you breathe it in. So we are making a vaccine. Many countries are doing this clinical trial where we spray the vaccine in the nose so that this person is protected right from breathing. So there are people who don't like injections. So we are currently working on a vaccine that will spray in the nose. So vaccines work that way. For other diseases, and I'm going to ask you, when is the last time you had someone with polio or seen someone with polio? Polio was a very dangerous disease in our children. It's a virus, and once they contracted this virus, the children, the virus would go to the nerve system, and the children will have disabilities. So they would be disabled, either in crutches or will not develop well. How did we overcome polio? It's through vaccination. Right now, only 2-3 other countries have polio cases here and there, but the majority of the countries in the world have not seen polio in many years. How did we do that? Through vaccination. You remember a disease called smallpox? I'm sure many of us in this room who were born after 1980, we don't have the scar that our parents had. A scar up here, and that scar was caused by the smallpox vaccine. The world vaccinated against smallpox until around 1978, 1980, they declared the world is free from smallpox. How did they do that? It's through vaccination. And for me, I get really excited to know that it will be in our lifetime where we'll be saying we got rid of polio, we got rid, I saw the other day, of many other small infections. Even TB will be gotten rid of. And how do we do that? Vaccine. Right now, as I mentioned, I'm a virologist. We are working on HIV vaccines as well. And we have a goal by the year 2030, we'll have a HIV vaccine so that our children and grandchildren will live in a generation where they'll say, we don't see HIV AIDS anymore, that used to kill majority of the people when we're young. So there's a lot of hope. There's a lot of ways to prevent infections, but the greatest weapon that I believe God has given to us is vaccinations. Vaccines are safe, and I've given you practical examples how vaccines have saved lives. Thank you. Back to you.
Thank you so much, Marianne. Thank you. I think people have idea now how what are vaccine and what are how are them maybe able to prevent the spread of these diseases. And like as teachers, we have a lot of encouraging vaccination process, as we are meeting a lot of population, it means students and their parents, and even we can be the voice for the country or for the community as bridge to more person and the population as well. Marianne, again, I want you to go through the key statistics or evidences based on findings that demonstrate the importance of vaccination for COVID-19. Do you have some statistical number that can grant us that vaccination is working on this spread of COVID-19 or other diseases? If so, how can we use those data, those statistical, maybe to do the awareness or to reinforce the significance of vaccination in public health and disease prevention?
Yes, so again, that's a good question about statistics. And the statistics I've been looking at, I didn't include them in my slide. I always look at the global statistics, first of all, of how many vaccines have been given, which country has the largest uptake of vaccinations, and of course, it's the countries in the Western world, but Africa is not doing too badly. Kenya, we are around 40 to 50% vaccinated people, so we have a long way to go. Rwanda is doing much better. And again, I want to learn from our Rwandese colleagues. How do you do it? How is a public health campaign done in Rwanda? Because in many of the diseases we study, Rwanda does pretty well in terms of uptake of solutions. And the way we know that these vaccines are working, when was the last time anyone in this room heard of anyone dying of COVID-19? The cases went drastically down. In Kenya, we've not had a death of COVID-19 for almost a year now. And why is that? Remember, I keep saying the virus is still here, it hasn't gone away. And it's because people got vaccinated. Many people got vaccinated, meaning that many people have a measure to protect them. And then now I'm going to introduce another word called herd immunity. So we don't have to have everybody vaccinated, but we can have 70 to 80% of our community or population vaccinated. It means many of these people have a wall of protection. They've created a wall of protection that they'll not get infected. And if they get infected, the virus will be gotten rid of. So if many people are vaccinated within a community, we have what we call a herd effect, HERD, meaning that if majority are vaccinated and we have 10 or 50 people not vaccinated, the virus won't have many pockets where it is going to infect because there's a ring of defense of many people being vaccinated. So if we can have majority of us vaccinated, we'll protect the most vulnerable. That's the elderly, the young children, the people with other comorbidities such as diabetes or hypertension, where maybe the vaccine may not work very well on them. But if I'm vaccinated, you're vaccinated, we've created a wall of protection in terms of the virus will more or less die or die with us, or it will have no effect. It won't replicate or multiply within us because we have that protection. So it won't spread to the next person and spread particularly to the person who is most vulnerable. So vaccines have worked. I've not seen any COVID death in the world in many, many months now. Many countries have even lessen the COVID mandates where you can land in Kigali, you can land in the US, and no one will ask you for your COVID certificate or please wear a mask. And why is that? It's because of the vaccinations. Our bodies now have been trained on how to fight the virus. And with that, we will see the cases of COVID-19 really go down to almost zero in each and every country. But never forget, the virus is still around, and the way to overcome any mutation that may come up is through vaccines.
Oh, thank you so much, Marianne. Thank you so much, Doctor. What I'm getting from your side is that if I'm getting vaccinated, I'm like protecting those people who are not yet getting vaccinated. I mean, as I do, as you do, as we are doing it, we are we are doing a great work. Let's all of us do or take vaccine to protect all other sides. Thank you so much. And thank you so much to all of you who contributed a lot to answer to this question. And as we are waiting for some more questions from participants, please let me remind you that we have to join the group of WhatsApp via the link shared with you. Please join. If you are still online, you join to make sure that we have a strong group and we'll have more other communications from different partners and organizers. Please make sure that you join the group of WhatsApp created. And then I would also like to invite questions. And as you ask a question, you may raise your hand or you can write your question on comments space. And if possible, you can even choose the one to answer your question. Please, your questions are welcomed. But as I'm going through the comments, there are some questions asked before. And the first one is assigned to Marianne. Someone asked if people who are vaccinated are 100% safe against the COVID-19. Marianne, can you help us to know if someone vaccinated is 100% against the COVID-19? The same case, you can go through the second question and the answer to the question that asking how many vaccine for a person to make sure you or he or she is safe and cannot be affected by COVID-19.
Yes, so I think the question was,
Marianne, I think you are muted. Okay.
okay, now I've been unmuted. Sorry for that. The question was on how many vaccines or how many doses one needs to be fully protected against COVID-19. That's the question?
Yes.
Yes. So the way the dosings were working is that you needed the first dose and then you needed a second dose, because the first dose is enough to at least start generating, for us as you've been vaccinated, the most important part of the vaccination is that development of a memory, or these white blood cells having a memory in terms of the remember the infection. So if you have a second dose and the second dose has been given 6 to 8 weeks later, or depending on the time frame of the vaccine you're taking, the second dose was to make sure that the memory white blood cells are well established to protect you against any of that COVID-19 virus. So having at least the first dose, it will confer to you some protection. Having the second dose will give you even more protection because you have more memory cells. And then now they also have the booster shots. So you can have a booster maybe once or twice a year. And the boosters are just to ensure that the memory cells are well established. And also the boosters may take or cater to the rapidly mutating virus in case it mutates. Remember, there was the Omicron, there was the Delta, the Alpha. So it mutates the spike proteins here and there, and that's how viruses actually normally, that's part of their biology. So the mutations again are well covered if you go for your booster. But for me, the most important is having at least the first and second dose, knowing that with that, you'll be protected. And if you'll encounter the virus, because remember I mentioned you breathe it in, so it will come, you'll encounter it through, once you breathe it in, but your immune system will be well equipped to fight it off. So you, what we are trying to avoid here is you going to hospital, you being hospitalized, you being put in the ICU on a ventilator and hanging between life and death. Vaccines help us save that life that way. So I hope I've answered that question.
Oh, thank you so much. And there was someone asking, so what is the importance of the third dose? But you have already mentioned that that is for protection or booster. Is it right?
Yes.
Okay, thank you so much. But someone also writing, is Jean Damascene, he is saying that you say that there might be another pandemic in the future. What would you say about the health institution regardless and preparedness to contact other pandemic of the COVID-19 nature?
Yeah, so actually those are the things that now keep us awake at night, worried, not worried really, but making sure that we are well prepared for the next pandemic, because trust me, we'll have another pandemic. But in this case, we have learned so much from COVID-19. We are actively doing surveillance. I had one of you say, Rwanda, they've not yet seen any Ebola. And trust me, there's a team on the ground in Rwanda on the borders doing and assessing the environment, assessing the people, assessing even the animals to make sure that a disease is detected very quickly, even though it's a new disease. And once it's detected, there are measures we need to work together with the government, Ministry of Health, possibly even WHO, to alert them that we are seeing something unusual so that we can quickly contain that situation, either through contact tracing, testing, and making sure there's the public awareness. So if we have those measures in place, despite the next pandemic coming, we'll be quite prepared for it. And as an African continent, I think we are way advanced in terms of pandemic preparations, in terms of we are always under constant threat. We've been having Ebola, we've been having chikungunya, there's dengue fever, there's onyong-nyong virus. All this can cause an epidemic or an outbreak, but we have now measures, we have institutions that are monitoring this. But a lot is yet to be done. We need more funding. We need such forums where we talk about it, where we educate our communities to note any unusual symptoms, to seek medical advice if they have to live healthy lives, to eat well, because the immune system depends on how well you treat your body in terms of your health. Are you exercising enough? How is your mental health? Because all these things work in unison for us to have a healthy, thriving community.
Thank you so much, Marianne. As we are still going through question and the suggestion, please feel free to write and keep writing your question and suggestion as we will collect them. And maybe after the webinar, we can even provide feedback, clarification, and the other answers to those given question. Please, as we also moving forward, remember to join to those 3 links shared in the chat space. The one link, it's about the group WhatsApp for Rwandan, and the next is the link that will be used to recruit health champions, and we also have another link that is going to be shared with you just to let us know. It's a simple survey, just to let us know how was the webinar, what to be improved, what to be added, and more. Please make sure you clicked on those 3 links to make sure that we are all using the time and we are all at the same page. And is there any other question, please? As you still have some, you may raise your hand. And I can see the question from Donuts saying that I heard of there is the 4th dose. have they found that the third dose, 3 doses are not enough? Lillian, you can go quickly and answer to that question, but we also have to think about time as we are crossing to 8:30.
No, I think even we'll have a 4th and 5th and 6th dose. But what I mentioned earlier, it's because the virus mutates. We have the Omicron, and every time it mutates, we may need to get a bit of a booster. The booster just reminds the immune system, hey, this is how the virus looks like, remember? So make sure so that if you inhale one of the mutated viruses, the immune system will quickly encounter them. But this 3rd, 4th, 5th doses are mainly being prescribed, as seen in the UK, for persons who are elderly, people who are over 60 or 55 years old and above, because the immune system at that point is a bit aged. We call it immunosenescence, or where the immune system ages as a person ages. So it needs all this boostering to make sure that this person is well protected. But as I keep mentioning, if you can just get the 1st and 2nd dose, that is more or less enough to confer you protection. Thank you.
Thank you so much, Marianne. Please, as I said, the time is to Julius. Allow me to invite someone else to say something. As I said, we are together with Elim Shop, and the one who is representing Elim Shop is Lilian Nyalanga. Lilian, are you still here?
Yes, I'm here. I saw some hands.
Say something, please.
Yeah, thank you so much, Marie. I saw some hands. Maybe you can give 1 or 2 people maybe to ask from to unmute and ask some question before I come in, if you don't mind.
Yes, please. They can do so. Is someone still raising a hand?
Yeah, I can see Jeanette. Let me just unmute her.
Okay, unmute her to ask.
Jeanette, you can ask your question.
Yes, thank you so much. My name is Jeanette, and I have like a question based on your presentation. First of all, thank you so much for the great and constructive presentation. My question is about, you mentioned that in the future we may face more challenges, more disease based on the climate change. And also for those to be at least on a good position, you have to take different vaccination. And the problem that you have here in our country, most of the people, they didn't know the importance of being vaccinated. They have a different understanding. Most of them, even us, we don't have more information about it, that we think that they will bring negative impact more than positive impact to our life. So would you please like organizing like the training or the session that could help people to be out, and also having like the big picture about their importance? Thank you.
Thank you so much, Jeanette. Priscia, can you let us know, or Marianne also can say something? Priscia, are you good at responding to that question? I can see that Priscia is not, maybe. Marianne, can you help us, please?
Yeah, so that's also a great question, because that's the struggle we also have in Kenya and also in many countries, where people view these vaccines very suspiciously. And because of the myths and misconception. And for me, I always start off by saying, first of all, vaccine saves lives. but yet there could be side effects, and those side effects are very important to note. But the side effects that you hear in the myths about sterilization, or they'll cause you to be infertile, or they'll lead to many other things, are not true, because we are seeing evidence that vaccines are actually saving lives. I've given you an example. We don't hear of COVID deaths anymore, and this is because the population has geared or gathered enough immunity to protect us against the worst parts of the COVID-19 disease. So we need to keep talking about vaccines, the benefits of vaccines. And if you hear anyone with some hesitancy, it's very important to hear what they're saying. What are they fearing? For example, I sit in a forum where we are trying to make sure that our young girls and boys are getting vaccinated against HPV. And when I sit with other parents, the biggest worry is about this, where we vaccinated these children when they're very young. Are we trying to control their fertility? Or are we saying our children are going to be sexually active? No, we let them, they'll be protected by God. You know, when the cancer comes, there'll be another solution. So I won't take my daughter or my son for HPV. And with such concerns, we listen very carefully and then take them through why what HPV is in the first place. It's a virus. It's transmitted through sexual interactions, and we want to make sure by the time this child is an adult, and by the time they're an adult and now they're having these adult relationships or sexual interactions, maybe in their marriages or whatever, they are protected in case they get infected by the HPV virus. In that, the body will be able to get rid of that virus. The virus causes cancer. So for me, I'm not even worried about the virus itself. It's the way it goes to the cervix, the way it goes to the anal area or the penile area, and then makes changes to the cells around there and makes this person now fight against cancer. Cancer is not a fight you want anyone in your generations, that's your children, your grandchildren, anyone who come after you to ever fight, because it's tough. Chemotherapy, radiotherapy, surgery. So if we have a tool that will prevent that from happening in your generations, please let's use that tool, vaccinate them. For me, I have teenagers in my house, my children, and I've made sure that they're vaccinated against HPV, and they know what we're doing. They know what the virus causes. And with that, they're also joyous to go even talk about it to their friends, with their teachers, and have more of these teenagers, these young girls and boys vaccinated against these diseases. So always listen, hear what the people are saying, where they're hesitant, and then counter that with the facts about saving lives, about protecting them from getting the more dangerous the diseases are, such as the cancers, and that we will have a healthy generation, a healthy society, and a happy society too.
Oh, thank you so much. Thank you so much. Before coming back to Lillian, I received a quick question from YouTube that is asking about why old people get more than 3 vaccines, and what problem will meet people who didn't complete those 3 vaccines. Please, can you use 1 minute and help us to answer to those people who are following us on YouTube channel? Marianne, can you hear us?
Oh, okay, sorry. Yeah, that's also me again. Why the elderly are getting more than the 3 doses, right?
Yes, why old people get more than 3 vaccination? Like here in Rwanda, they told us that old people can take the 4th one. So why are them taking the 4th one? Is there any problem that they will meet if they don't take those 3 more than 3 vaccines?
Oh, it's because I think I'd mentioned earlier what we call scientifically called immunosenescence. What does that mean? The immune system ages, the immune system in the elderly does not function as it should because it's grown old with the person. So it needs more assistance from the vaccine so that it can keep remembering that infection, so that it can still keep producing those white blood cells that remember. So the more elderly you are, the better you're better off having a booster. And I'm very happy to hear in Rwanda you're on your 4th booster. In Kenya, we're still getting people to get their 2nd and 3rd doses. So well done to you. But it's important that as you age, you look better after yourself. And if there's a booster, please go for it, because the immune system has also aged and it needs the extra help, the extra boostering, in other words, so that it can formulate more of these white blood cells that will protect you or protect the elderly person from the virus.
Thank you so much. Lillian, the floor is yours, please, as we are running out of time. And the dear participants, keep being patient, like 5 minutes, as we are waiting to hear from Lillian and Celestine.
Oh, thank you so much, Marie, for that wonderful facilitation. You'll forgive me today, I'll not put my video on because I'm having challenges also with internet here. At some point I was kicked out. So yeah, thank you so much, Marie. I'm Lillian from Elimu Shop, and I'm so grateful for the Rwandan team. And indeed, we are finishing this webinar. This was our last webinar, and we are finishing it with a bang. Thanks to the work that you've been doing behind the scene to ensure that it is well attended, and the interaction and the engagement on the chat has been just amazing. And thank you so much, Dr. Morevi. As always, we always learn a lot from you. I think we need to have another project where you just come and talk to us about this antimicrobial resistance and also about vaccination, because there's a lot of interest around that, these areas. You know, we need to learn more and see how we can protect ourselves. Thank you so much also, Christian and Jeanette, for the wonderful discussion in the panel, in the panel, and just sharing how this public health is important, you know, in the education space. But most importantly, also, I want to thank the audience. Thank you so much. You've been with us. First of all, the turnout was so amazing. And then you've been with us from the start up to the end. And you asked very good questions. You've interacted on the chat. It's been awesome. I mean, without you, this would not have been a success. And just to show our appreciation, we'll be reimbursing the data bundle you used to join this webinar, and also we'll be issuing you with certificates for participation. And for that reason, there's also, like Maria has shared, there are links that have been shared on the charts, very important links. First one, the one for the WhatsApp group. Ensure that you click on that link and join the group, because in that group we'll be sharing other important links for recruitment. I'll be talking in a short while about the recruitment, and then also the other one for the feedback, because we want to hear your feedback about this webinar and how we can improve. So I know you're wondering, why is it that we asked teachers to be part and parcel of this webinar? You've heard teachers are very important in the community. Our word carries a lot of weight. And this important information that we are learning here, we want you also to help us in recruiting public health champions from the community, who will also undergo another series of online training and gain more knowledge and skills. And also from that, the knowledge that they are gaining, they'll use it to share this information on public health to the public through their social media platform. So we want you to use your influence and to just go into your communities using this link that we'll be sharing with you. Help us recruit these public health champions. We are looking for young people aged 18 years and above who are willing to be part and parcel of the second phase. So this is not a forced activity. They'll just opt in. It's voluntary. They opt in, and then when they register, they undergo the training. Yeah, so thank you so much. So make sure that you join the WhatsApp group so that you can share more information around the links, and also the WhatsApp group will also enable us with the logistics on how the reimbursement will happen and also how you will be issued with the certificates. Otherwise, thank you so much once again for being part and parcel of this, and back to you, Marie.
Thank you so much, Lilian, for everything, for all clarification given. And thank you for organizing such a webinar. It's really amazing. As I used to say, the time is too jealous. We could wish to have more than 1 hour, more than 2 hours, but hope to keep communicating as we are having a group WhatsApp and other channel for communication. Please allow me to invite the representative of Shule Africa, if she's there. Shule Africa, Celestine.
Sorry, Celestine is not here with us. She's coordinating the live streaming on YouTube, so she's not able to join us at this time.
Do we have another representative?
No, okay, we'll just end from there.
Oh, okay. Thank you so much. Thank you so much. As we are still moving, please fill those forms. We are having only 63 participants on the WhatsApp. Kindly join. Lilian, are you closing or you have already closed?
So no, sorry. So Anne-Marie is sharing the links for WhatsApp on the chats. Please click on those links, and then Anne-Marie, you can finish with the vote of thanks. Yeah.
Okay. Anne-Marie,
thank you so much. Thank you. Thank you, Marie. Thank you, Christian. Thank you, Jeanette. And thank you, Lilian from Elimu Shop. Thank you so much to our participants. You know, anytime I come here, I write the questions you ask, and I'm amazed at how every country or every region that we've had these webinars in gives such amazing comments and asks such good questions, which I'm sure will forward them to the doctor to later review and just guide us on how to go forth. To us here, we say thank you so much, panelists, for sharing your wealth of knowledge with us this evening. Thank you to our participants for availing yourself and giving us an extra 11 minutes of your time. And we thank you also for just allowing yourselves to become the recruiters of the public health champions in your communities. I could see it on the chats, a lot of teachers saying you have the power to actually influence. So I'm grateful, and we are grateful from this forum that you actually see the need and why you are the people we chose to have this forum with. And of course, we want to say thank you so much to our partners, Africa Union, Africa CDC, MasterCard Foundation, Shule Africa, and Elimu Shop for making this campaign possible. It has been a good run in 8 countries. We thank God for this far we've come. We thank you so much for turning up, and have a good night, and God bless you all. Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you.
Goodbye.
Bye.
Goodbye, Marie. Thank you.
Goodbye, Anne-Marie.
Goodbye.